eyeglass that I could see to sew under my, the distance from under the sewing machine, so I could sew.
Okay, so sewing is really one of your main purposes for coming. Did you have anything else that you were hoping to be able to do other than sewing?
I'd love to be able to drive, but I know that'll never happen, so.
Okay. Now, has your vision been stable, or has it changed recently?
No, it has been the same for several years now.
Okay. And how long have you known that you've had macular degeneration?
13 years.
Okay. Now, we noticed in your chart that it's the wet form. Did it start out as the dry form and then convert?
No.
Or was it always wet?
It was always the wet type.
Okay. Have you had any surgeries or procedures to treat it?
I've had surgery, but not to treat that, per se.
Okay. What surgeries have you had?
I had a cataract surgery, and then I had a little hemorrhage in the left eye that they went in to remove the blood from the fluid.
Okay.
Which the blood leaked in behind the retina, and so it was too late to do any good anyway. So
I see. Now, when did you last see Dr. Aberg for your retinal care?
It would be a year ago in February, I'm thinking.
And how often does he like to see you?
Once a year.
Sounds good. So you're pretty much due to go back anytime.
Yes.
Okay. Usually when you're in the care of a retinal specialist, we don't dilate your eyes and look in because he takes care of that. We can do that if you'd like us to today, but generally we focus on the devices and the rehabilitation and then let him care for the health of the eyes.
Right.
Is that all right with you to
that's
do it that way?
What I had planned, yes.
Perfect. We might still look in with our light just to take a quick peek, but we won't dilate. And
Okay.
We'll do that at the end if we do that. So
Okay.
thank you. I'll take your case back. How is your overall health? Any issues other than your eyes right now?
I feel wonderful today.
Good, okay. Now, as far as the things you checked on the form, we noticed gastro reflux issues and arthritis.
Right.
Are those the two main issues that you have?
Right, and that it's because I have a malrotation of the bowel is a problem, so.
Wow, okay. Is that really a painful thing?
When I have a problem, it is very painful, although if I don't eat the wrong things, which I have to learn still what I can't eat.
Wow, that's interesting. I have not met anyone that's had that problem to really know what happens. Is it you eat something specific and then it causes the bowel to rotate and twist? And that's
well,
painful?
it's already goes up and folds back down, and so it just doesn't want to pass through that fold.
Okay.
Anything that has a lot of fiber apparently is working too hard and doesn't want to pass through that fold.
Okay.
So the food sits in the stomach and ferments, and of course it causes a lot of pain for it to try to pass.
Right, okay. And then as far as your daily life, Carolyn, are you still in your original home with your husband? Is that your living situation?
Yes.
Okay. You said you don't drive. What are your hobbies and what do you do on a daily basis?
I love cooking and I crochet.
Okay.
Clean house.
Clean house, yeah. Something we all need to do more probably. And then as far as the cooking, any issues with seeing to cook the way you would like to do it?
Oh, I don't have any problem. The only thing that is like when you're frying the meat to try to see how brown it actually is, because the meat is already brown and I have a problem telling whether it's brown enough. I also golf, by the way.
That's fantastic.
Yeah.
And how do you do for that golfing visually?
I can see to hit the ball. I just have to have someone with me to tell me where it goes.
Okay.
And usually I can feel which direction it goes.
All right.
Sometimes.
Do you watch television?
I do.
Any issues with that at home?
No, because I have a
great
monocular that I use to watch TV.
I wanted to ask you too, Carolyn, any problems with falls in your home or bumping into furniture?
No.
Like that? Okay.
You?
I actually took my glasses off
Okay.
and sat them by the needle and got as close as I could, and I threaded the needle.
Right.
That's great.
I actually do that with my glasses. I thread my own needle and sew buttons on
Yeah. So that part of it you can do without help. It's just the sewing machine.
because I can't get my nose under that, close enough to that area.
A right eye monocular
Yes.
central full field telescope. And do you know the power of your telescope?
No,
We might have it in the record. Was it
I don't know
from
that.
our
It's
clinic?
well, Dr. Batts and Jamie Brady
Yes.
worked together to make
Okay.
this prototype, actually,
Great.
several years ago. So I don't know if it would say on there.
Okay, sure, we can look at that in a moment. What devices do you currently use other than the telescope to help you
And
see?
I have the glasses.
Okay, may I see those?
Sure. And of course, it's just for
Okay.
the right eye also.
Right. Is that your favorite eye, the right
Well,
eye?
the left eye is the one that the blood hemorrhaged into the fluid and got behind the retina. So
Okay,
actually, I don't use that eye.
okay. Are you aware that the brain has just shut that eye off then? Or can you consciously make that happen?
Well, I do have some vision down here.
Okay.
It's just straight ahead, you know.
Sure.
I can see my hand moving over there.
Right. Okay. So she has a clear image, monocular, prismatic. Well, it's not a prismatic, but a reader actually. Right eye only, and I don't know the strength, but that might be in the record, so we could certainly look.
I think
for-
it's a 5, but
Is
I'm
it
not
a 5?
sure.
Okay, that's very possible. And then your telescope isn't marked, so we also could look that up and see. Is this one working well for you?
Yes. Oh, yes. So
Okay.
now, when they asked me what I needed, and I told them something, a certain distance, so that's what it works for.
Okay, and what distance is that?
How far is the living room?
12 feet,
Okay.
Yeah.
about as far as you get away from it.
Do you wear this scope when you ride in the car?
No,
Do you wear anything in the car?
no.
As far as sewing, you mentioned knitting and crocheting.
I don't knit. I
I'm sorry,
crochet.
crocheting, yes. And I know that requires obviously seeing the needles. What are you using right now to do that? Any devices?
Those glasses, yes. And the fuzz comes off in your nose from the yarn.
You know, that's true. I hadn't thought of that, but that would make sense. You have to obviously hold it very close to you.
I do,
these-
yes.
Okay. Is it the closeness of holding it that bothers you, or is it that you feel these are not strong enough for that?
For sewing,
Mhm,
it's
for
the
sewing.
distance.
Okay.
I mean, when you put that on, it magnifies really strong, so your work has to be right here by your
Right.
face.
Okay.
Any farther away, it's very blurry.
The reason that I asked that question is because we have other options, but a lot of them require that close focal distance. So if we want something that you can hold back a little further, we'll have to look at devices in that category, which is fine. There are
Right.
there are some good options out there. So really, Carolyn, your primary need is sewing, and distance you feel like you're doing all right with the current telescope. Am I understanding
Right, I
that
am.
correctly?
And I have binoculars, which
Okay.
we use at home if I want to look out at the window at birds or something.
Okay.
They gave me a lighted magnifying thing, which I don't ever use. Someone could have it if they needed it, because
Oh,
I don't
really?
use it. I should have brought it, so
Okay.
maybe you could have gave it to somebody.
Well, thank you. I'm just curious as to why you don't use that one, the lighted one.
Because the glasses take the place of that, and
Okay.
I don't have
It's
any use for it.
interesting. It's interesting because the light provided in that magnifier really helps some people, and others they don't need that, and they can just get by with typical magnification. So,
Now, at home when I'm reading, I have a light that comes right, it's on a stand and it comes right down, a bright light,
great.
faces right in my books, you know.
Good
Right.
lighting is so important.
Right.
I'm glad you have good lighting. That's great. You also mentioned that you wear sunglasses. What color is your tint?
Brown, tan, gold, you know, between a gold and a brown.
And how do you like those? Are those working?
Yes.
Great. We always have other tint options too if you ever wanted to explore that.
Right. I have tried other ones, and the blue or gray,
Yeah.
that makes it darker. So
Right. Brown is a good color, and many of my patients like the brown the best.
Right.
So that's a good tint for you. Let me hand these off to your husband here for a moment. And would you mind pulling out the other pair of readers from her purse so that I can look at those?
they're way down on the bottom, Rex, in a case. So
Okay.
I haven't had them. I had the
I see.
problem with the left eye.
Okay. So these are prismatic readers. And you said you thought these were 3 power?
I think they are.
3X maybe? Okay. They're very cute. Nice little small shape and fit well in your purse, so that's great. Do these do the trick, or do you think you need a stronger power?
Those are not strong enough,
Okay.
really, for
What?
reading or recipes and stuff, but they're okay to look up
Okay.
a price on a grocery.
Sure, I understand. So these are Mattingly prismatic readers. We'll have to read the power in the lensometer because they're not marked, but we think they might be 3X. So if one of you could read those for me, that would be great.
Is the 3 is
As well
lesser
as-
than the 5, right?
Yes, correct.
Right, okay, so to make sure I had them right. That's why I think that other one was a 5.
Okay. We have in the record that you also had a Beecher telescope. That's the kind that looks sort of like bug eyes. Sits on the nose. I can show you one and see if it looks familiar. Something like this, Carolyn? You're welcome to touch it and see.
No, I don't.
Don't have anything like that?
No.
Okay. Maybe you had tried it at some point in the past and didn't like it, but we had it marked in the record, so we just
Oh,
wanted
I
to
may
see.
have. Is this for driving?
No. Well, it could be mounted that way. It generally is not. It's used
No.
straight ahead.
I don't
Okay.
remember seeing one of those.
All right. I had noticed in your record also, Carolyn, that you'd received services through the Michigan Commission for the Blind at
Yes.
one point, and they provided some devices. Is that something that was a closed case where they said we're finished helping, or have they continued to help you over the years?
I have never asked, but I do have another pair of glasses in my purse that I got through Commission of the Blind. I think those are 3 power, and I keep those in my purse for grocery shopping.
Good idea.
Now, does the Commission of Blind take care of those things?
Well, the way that the commission works is that once you have what they call an open case, or you've asked for services, they help you until the case is closed, as they call it, or they've paid for a number of devices and you're pretty happy. Once they close the case, then you're not considered an open client, and they won't help you unless we reopen the case or ask for additional help. So I would need to re-refer you back to the commission, which I am happy to do, and you definitely still qualify for their services. And if they have the funding available and they're willing, then they'll reopen your case and provide some additional items possibly. They don't, however, pay for video or electro-optical devices usually. They prefer to pay for the items like the handheld magnifiers, glasses, anything that's kind of on the higher price range end of things they prefer not to do. And so we may have trouble getting any help financially for anything like that, realistically.
And of course, the insurance.
No, I wish they did, but insurance companies are not providers of any low vision devices. Well, let's get started. I want to check your ability to see the eye chart, and I know that can be a little frustrating. Feel free to use your peripheral vision or side vision to see the chart as best you can.
That's
do you do
all
that
I
now?
have, so.
Or I understand. You're probably very skilled at that. Do you know which way to look, up, down, left, or right, of the object that you're trying to see in order to utilize your side vision?
Mhm.
Which way do you look?
I think I use my inside on the right eye.
Okay.
The
Your
inside
nasal.
peripheral, yes,
Okay.
more.
Well, that's good to know. So let me get the chart. Eric, actually, yeah, would you stand for me and hold that? We're going to start, Carolyn, with your right eye. So you can cover your left eye with that. And just tell us the number you see if you're able to, straight ahead. Eric is holding it there.
It's a 5 or a 6.
Very good, it is. Let's
It
challenge
is.
you more here.
That's a 2. 7. 9. 4 and a 3. 5, 0, 1, 8. 2, 5, 7, 3. 4, 1, 7, 9. 7, 5, 8, 2, 5, 3.
Oh, not bad.
What was the bottom left one? 2?
No, it's a 5.
It was a 5.
Yeah.
8, 4, 6, 7, 0, 1. 2, 9. Now they're getting busy. It's 6.
Keep going.
There's more than one row, and I'm getting them mixed up. So
Okay, that's all right. Take your time.
8, 7, 4.
Wow, very good. Can you do the next row? It gets smaller.
I know. Probably it's messy.
It's difficult, sure. Any guesses? If not, that's okay.
Well, I see a 1 on the bottom row next to the last one.
Very good.
But that
Okay.
could be a 5 or a 6 on the 5, the last one.
It is a 5. Okay, very good. We'll let you take a break for a moment and blink a few times there. So Eric, just note the level there. And we use the Fine Bloom chart at 10 feet, the Designs for Vision. So we're going to do the other eye now, Carolyn. Please cover your right eye. This eye is going to need a larger level of chart, Eric, just so we know. Okay, we have it up there, Carolyn.
You know what? I don't see him or the chart.
Oh, okay.
So all I see is what's from. I don't see the tips of my fingers right now.
I see.
I can see the palm of my hand or the back, but not my tips
Okay.
of my fingers. It's
Well-
black from there on up.
Okay, let me try something. Can you hand the chart to me for a moment? I'd like you to use that side vision, Carolyn. I'm going to get out about 5 feet from you. Are you able to pick up the number by using peripheral?
I don't see anything.
Okay. Even out here?
I seen you move something out there.
Okay, just checking. I thought maybe if I could hit that sweet spot on your retina, that might allow you to visualize it for a second. Okay, thank you. You can take that down. So we have extreme peripheral hand motion right in the left field only. All right. Now, when you read, Carolyn, do you have a pair of standard bifocal glasses that you use?
No, just the ones that
Just
you
okay.
gave Rex.
Have you ever worn glasses for regular nearsightedness, farsightedness, or
Yes, I
astigmatism?
did.
And how long ago did you abandon wearing glasses for that reason?
13 years ago.
Okay. Just wondered if that was something that helped in any way or not. And it appears it didn't.
Not after I lost my central vision.
Okay. Let's just try with nothing then and see how we do. And then we'll try with your magnifying readers also. If you could hold that for me, right at that distance, try not to move it. How low can you read on the chart?
DOBHR
Great. Try the next line.
ZRHS.
Okay. And how about the next line?
No.
Can't get any on that line?
The E on the last
Okay.
one.
Very good. Let's switch.
RE.
Oops.
There's a HRE. Okay, OHRE.
Not bad. Got a few of those. Thank you. So that is 3.2 m, or 40 centimeters. Let's try this eye. I know that there's probably not much there. If you move it into the vision you do have, are you able to see anything?
I can't read them, no.
Okay, just trying. Thank you. So less than 8 m in the left eye in extreme gaze. This is a good card because it has actual text. So I'm going to let you hold that where it's best. And I realize that's fairly large, so try going down until you can no longer read it and let me know what that point would be. So this is a reading card that utilizes actual words and sentences versus just letters, which is definitely more real world. It's a lighthouse, continuous text.
Lighthouse Low Vision Products.
Wow, very good. Let's flip you over. Too easy. She's at roughly 10 centimeters.
My dog has
sorry,
a...
10,
Oh, my dog likes to play catch with a stick.
So 6 to 8. Very good. Can you try the next one?
The circus is fun.
Okay.
Clowns do many things.
Okay, that's great. Thanks. And that was 0.6 m, 2030. If you'll slide those off for me. So, Erica, what power did you say these were?
It's 4.5.
4.5, okay. All right, what I'd like to do now, Carolyn, is have you stare at on your target. Here, let me find something that will be easy to look at. Are you able to see that square above my finger?
Yes.
Okay, just stare at that square for me. Okay. Cover test is obviously difficult to do when there's not central fixation. There's no movement at all, but it appears that the left eye is a bit of exotropia, or it could just be that that's the eccentric viewing natural position. I'm going to check your pupils now, Carolyn, so shine a light in. Look straight ahead, please. And when I'm doing this, I'm trying not to bleach out your retina too much. But they are both reacting. The left eye has a very minor APD. I'd like to check your side vision now, and I know that it's the best part of your vision. So if you could just put your hand over your left eye for me. And I'd like you to stare where you think my nose would be, even if you can't see my nose. And tell me if you see how many fingers I'm holding here.
2,
Mm-hmm.
1, 3,
Mm-hmm.
2.
Good. Now cover your right eye. Same thing again. I realize you can't really see much of me right now, but I'm going to come in from the side. Can you see my finger?
1,
Good.
2, No, I don't see
Okay,
it.
that's all right.
And I don't see your hand.
Okay. So we've got a little inferior and left field. Thank you. You can take your hand down. So let's try something a little bit stronger and see how you do. 20/30, Carolyn, is very good with those glasses. I'm quite impressed with that. Not that we couldn't get it a little bit better, but that is very good. Keep in mind that the stronger we make it, the closer you have to hold it.
Right.
And so that's the compromise with this type of a setup. I'm going to try a 5X at near, since you have a 4 and it's just not quite strong enough. Let's see what we hopefully I'll have one in stock here that we can try. There we go. So this is a Right Eye 5X, exactly the same brand that you have now. You can close your eyes when you put those on. And I'm going to give you this back and some extra lighting too, which may help a little. Okay, how low can you go now?
Well, I'm still at the circus.
Okay, can you get the next one with effort? I'm going to move these up just a touch on your nose. There. Okay, thank you. What do you think?
Has
Carolyn?
a bird. I got has
Oh,
a
okay.
bird.
So there's a little bit there. Why don't we try going...
That sings.
Oh, very good. So it did take you down at least one line from the previous pair.
Oh, Carla? Is that a name? I don't know that first
I don't
word.
actually have it memorized. I could
Oh.
look.
She has...
Okay. Well, if you
I don't know. I could figure it out if I
Sure.
studied it long enough. The worm, something.
if I can have the chart for a moment, and I can see what you were reading. So she was able to get 0.5 M, and she was attempting 0.4 with a few words successfully. Let's switch the glasses and try one power stronger yet. This may be too much, but I'd like to try at least and see. This is a 6X clear image right eye.
Carla has a bird that sings.
Great.
She has the bird. She lets the bird fly around the room.
Okay. Keep going down if you can.
We have a, I got those words.
Okay. I'm going to ask you to take a break for a moment.
It's kind of the second sentence there.
Thank
Is
you.
that right? We have something on the last one.
We do. We have a bird feeder in our yard.
Hmm.
Yeah, very good. So she was able to see some of the 2020.4 M with the 6X magnification. So the question becomes, Carolyn, how much magnification do we want to go with? Do we want to bump it up one step or two steps in magnification power? If we go up two steps, you can see some of the 2020 or our standard of perfect line. But if we go one step, you're still seeing a whole line better than you were before, and you don't have to hold it quite as close. So, and it might be a bit more comfortable. It'll give you a little bit bigger field of view. So would you like to compare those two again and try that? See which which is better for you?
Actually, I'm happy with what I have.
Oh, okay.
So
Very good. I was thinking
there isn't
that
anything that I struggle to see.
Great. Well, I was
Except-
thinking you mentioned something about the ones you have not being quite strong enough. So I was thinking you might want a little bump, but
No,
no
I-
problem.
No,
If you're
I
happy,
think they're fine.
good. And just know that we do have increased powers, and the
Right.
power you're at is not nearly as strong as they go. So they certainly could be bumped if it ever needed to.
Right.
So just let us know. All right, thank you. I'll give you that one back. What I'd like to do now is talk to you a little bit about the sewing, because that's the primary reason you're here.
Right.
There are options that we can show you for that. The bulk of the options will require a close focal distance or a close working distance, which is the issue you're having now. So even if we increase the magnification and make it a little easier to see, you'll have to get it closer, and that'll be an even bigger issue for you. So my goal today is to try to find you something that you can use at a more comfortable working distance, but still gives you enough
Right.
magnification.
No, I tried. I actually hemmed a pair of pants by using my finger as a guide. I got it under the machine
Wow.
by getting my nose as close as I could, and then I could feel the hem
Mhm, yeah.
on my nails and the zipper foot,
Wow.
which came along. And, but
That's amazing that you were able to do
well,
that.
I work every day try to use what I have to the best that I can. So
Good for you. Good for you. I would like you to not have to do that. Do you like to use the sewing machine?
I used to make quilts all the time.
wow. Okay.
And I don't like to have to run to someone to have something stitched, you know.
Sure. Well, the sewing machine is a different issue than the knitting, because obviously the machine is set at a particular working distance, and you
Right.
can move your nose closer, but the machine is where it is.
Right.
Pretty much.
So you can't get your nose
Right. And dangerous,
Close enough.
obviously to get
to
too
do
close.
what I did.
Yeah, probably, but good for you for figuring that out. So we might be able to experiment with clip-on magnifiers that might attach to the sewing machine and allow you to just look into the magnifier. It will increase a little bit of magnification, but it may not give you enough. You'd still have to lean in and get somewhat closer than a comfortable distance, but that's
Right.
an option. Sewing machine is a bit trickier because it isn't like sewing where you could slide your hands under a magnifier. We have like closed circuit televisions and video magnifiers, things that allow you to put your hands under and project on a screen, but a sewing machine is complex because it can't fit under something like that.
Right.
There are some video options that might work, though, that I'm thinking about. For instance, there are some magnifiers that have a camera head that you could point at your sewing machine, and it would project what you're seeing onto a monitor, but the head is flexible and you could point it and twist it at whatever you want to see. And it's not like a video magnifier closer to television where you have to slide it under. That head is mobile. You can position it anywhere. So something like that would work probably. Anytime you're getting into video magnifiers and electro-optical devices, the costs increase obviously because it's a more sophisticated piece of equipment, more like a computer.
Right.
The issue becomes when you need a certain level of magnification, in order for it to be usable and to give you the field of view you need to sew, you might have to go to something like that to allow you to see much more of it at one time on a screen. Have you tried anything like that before?
Now, we did have a screen that I put a book under,
Okay.
and it magnified the book up on the screen, but I don't need that. I mean, it didn't do any better than the glasses now that I have. At that time, I didn't have those glasses, so
I see.
so I gave that to Commission of the Blind or Home Health Care or something.
Oh, that's very nice. Yeah, that's kind of what I was referring to as far as that closed-circuit television, or they're also called video magnifiers. So that is, it's very useful for reading, but it also, something like that, but that didn't have a fixed hole that you had to slide the item
Right.
under would be an option for sewing. The difference between that and sewing is that sewing we have to have the working distance further away, whereas with reading you're comfortable holding
Right.
it close in order to use your glasses. So I'll show you some pictures of those. I don't have anything in stock except one that I can show you. But it's something that could be easily demonstrated in your home to show you how it would work. So let me show you a few things here, Carolyn, and give you some options and see what you're interested in. It kind of depends on how much magnification you actually need as well, because if the crocheting needles are large enough and you don't need a lot of magnification, then something like this may work. This is a hands-free or chest magnifier, and it hangs around your neck so that you can crochet under it.
Right.
Have you tried this before?
I've seen them.
You've seen them? The issue with these is that they don't come very strong.
Right.
But if you don't need a lot, then it might work for you. So this will go around your neck, this string, and it just hangs. Now, we can adjust it, so we probably would want it higher, probably about like that.
I'm getting a glare from those.
Oh, okay, sure. And we
There.
can, let's turn this light on. Is the glare still there?
Yeah, I see the light.
Okay.
Okay,
We may have to kill the room lights, so
There.
we'll see how that goes.
if I tip it this way.
Oh, that's pretty dark,
Yeah,
though.
that's too dark, yeah. And if I just tip it, I don't
So
have
at the right
light.
angle?
Right.
Okay, let's try something. Because did you happen to bring your crochet needles with you?
No, I didn't.
Oh, that's all right. Let's just try something like this. I'm going to hold this so that you don't have to hold on to the chest magnifier. And if you need it adjusted for glare, just let me know.
I do right there because that light's right in the way.
Now keep in mind you're not reading when you're crocheting, and the reading is a much more intense task most likely than seeing your needles.
Right.
So I don't expect you to be able to read really small print. I just want to know your opinion about whether you think this would be enough magnification.
To crochet, I mean.
Mm-hmm. And we can also demonstrate with a couple of pencils or pens. Would that be more similar?
See, the only thing I can read is this A magnifier should.
Okay. So that is, let me see here, excuse me, 3M. Let me take this from you for a moment. I'm going to give you a couple of pens. I realize it's not exactly the same diameter, but I'd like you to just see if you can visualize the tips there.
It wouldn't be close enough for me to see to pick up the
Okay.
stitch. No.
I kind of thought that would be the case, but I wanted your opinion before I assumed. These are close focus microscopes. So what you'll do, Carolyn, is put those on. Now these are for both eyes, but obviously you don't use your left eye, so we're not going to worry about that. But what I'd like to do is hold up something for you to focus on at the distance where you normally knit, or crochet, excuse me, which just show me that distance with your hands.
Wow, that's a very, very small.
You're going to have to focus the scope. It's not focused right
Oh,
now, so it has to turn.
where
And I'll guide you
on the end?
right here.
There we go.
Do you crochet at that close of a distance? If you could see it, where would you prefer to hold your hands? Maybe just show me without the chart and show me with your hands how you would.
Oh, I would be here if I
Right there?
could see.
Okay, so let's try right there then.
I'm not picking anything up clear.
Keep turning. You're probably going to be at the limit of one way or the other, turning it as far as you can, nearly. This may not focus quite close enough for that distance. Anything?
Well, I saw Helen, I think. Is there a name Helen on the top?
Yeah, right there. Okay.
Okay.
So those aren't giving us close enough working distance. All right, let's try this. I need to have a trial frame. Something to clip it onto here. Oh, here's one. I found one. These aren't lovely, but they'll work for trial. Once again, Helen, or excuse me, Carolyn, this isn't, you just said Helen, so that's what I had in my head. This isn't very strong, but it might be just strong enough, so we'll try it. This is a 7 diopter Opticade clip-on magnifier. And you're going to be looking through this lens that's clipped in front, and we can raise or lower it, so you'll have to find
Right. Well,
where
it
it's
was
best.
there.
Oh, I'm sorry, did I mess it up?
Okay, my bird sings. Helen has a pet hen, and dogs make good friends. And Jack can make a good cake.
Good. So, we're going to go smaller.
The hen was sitting on the shed. Betty spilled some jam on the rug.
Good.
I will make a visit.
You're doing well there. Is that as low as you can
well,
go
it
there?
doesn't make any sense what I'm thinking I see. I will make a visit for a red pen.
Sure. Let me see.
What does it say?
Good question. I'll make a wish for a red
Oh,
pen.
wish,
Yeah.
not
You were close.
visit.
That was pretty close. All right, let's try these as your crochet needles now.
Okay. Okay, they would work right there.
Okay. How is the level of magnification for you?
I'm going to read the...
Oh, read the pen? Sure.
I got it upside right, but I still can't read it.
Well, it's
Starts with a C-R-E-N-P-A,
I don't expect you- I don't
whatever.
I don't expect this level of magnification to get you to see really small print, but what
Right.
I'm hoping is it would be enough for you to be able to crochet.
Yeah, but I can crochet, so that isn't what I'm looking for.
What are
I'm
you
looking for something to see under a sewing machine.
A sewing machine. Okay, well this may work for that as well though. Because if you're able to see to crochet, then if you're viewing the sewing machine needle with this at the right distance from the machine, it may work for that.
Okay.
That's what I'm thinking too. Let me take that from you.
I actually took my glasses off
Okay.
and sat them by the needle and got as close as I could, and I threaded the needle.
Right. That's great. Well, I think that you don't need a lot of magnification to do that. If you're going to,
See,
sit
now
further
this
away
would
from
be fine right there.
Works for clipping your fingernails too.
Yeah, that too.
Painting your fingernails.
I couldn't do that either.
Well, the nice thing about this amount of magnification is that even though it won't get you to see real fine detail, it allows you to be back a little bit further, which is what I was trying to accomplish
Right.
without having to use your hands.
Right. No, I'm not sure where the, even if I had to tip to get to the edge of the machine, I don't know how far away I am, but
Well,
see, I could see good right here.
it's about
so.
12 inches.
Is that right?
So it's worth a try. Maybe that's something we could send you home with and let you
Yeah.
experiment with it. Keep in mind, you can adjust how far this sits from your eyes as well as the angle
Right.
and everything. They're pretty adjustable. Do you have a pair of glasses that it could clip to right now that aren't magnifying glasses? Just regular reading glasses or regular prescription
I think I still have
distance?
my old prescription glasses at
Do you?
home, yeah.
Okay, that would be perfect then. Otherwise, I can send you home with that frame.
No, I have.
All right, let's do that. Let's try it anyway as an option, and I'll show you a few other things. Oh, we're right. We have needle and thread. Excellent.
Oh,
Thank you,
I
Erica.
had to use it before, personally.
I actually had a little thing in my purse.
You did?
That little packet that has the needle and thread in.
Can I have that back? Thank you.
I want to see if you can do this.
Now, this is a challenge. This is the ultimate challenge because threading a needle freehand is a very fine task. I'm going to clip this on. Okay. I think I need to raise it a bit. I'm going to give you the needle. Probably going to have to hold it out a little bit, maybe a little further than you're used to.
Have I got it?
It's so fine, I can barely see it here. There we go.
Here, let me take the thread.
Okay. The other issue with needle threading is that it requires depth perception
Right.
to visualize the hole, which you don't have because you only have
Right.
one functional eye.
Right. I'm
And-
hitting it, but
Oh, actually, you're there. You're right there.
Thread is.
It's just stuck, but it's right in the hole.
it's probably frayed on the end
Yeah,
of the.
it is. Yeah, very good. Okay, thank you. So this might be enough power, which is kind of exciting. We'll have to see, though. So now, Carolyn, I'm going to take a little break from showing you devices just for a moment to check your prescription at distance and see if there's anything I can do with nearsighted or farsighted correction or astigmatism correction to help. And I realize it's not going to be a big difference either way, but just give me your feedback as to whether the lens makes it clearer or doesn't do anything. Okay? Get this out of the way. And I've chosen plus and minus 75 as my starting point here. So I'm going to hold that over. Just stare down at the numbers Erica's holding up. And does this do anything for you?
No.
About the same, or is it worse with that lens? I'll remove it.
I can see what it is with or without
With
it.
or without,
so-
okay, that's the plus 75. Let's try this one.
Let's try to go smaller.
This is minus 75. Here's without, or with. Without.
Not that much difference.
I can still see the 4, 7, the 1.
Okay.
I'll try the bottom.
Let's go smaller. The bottom.
That'd be 80. And this is 63.
Oh no, go to 80, please. Yeah. So let's try this target and see if you can tell any difference. Here's width. or without?
Actually, I can see with it.
A little bit better with it?
Okay, now move it again while I got my, yeah, I can see better with it.
Okay, so she prefers the minus 75. Let's have one more choice. This is minus 150, so I'm going to give you two lenses. Tell me which is better in comparison. Here's number 1. Or 2. One.
Okay.
Oops, I'm losing it. There we go. 1. Or
Okay, that one.
2. Okay.
I'm concentrating on one number at a time.
Okay. And one moment, I'm just trying to find the right lens here. And here's another choice. 1. This is minus 25. Or 2, which is minus 75.
Okay, now go back again.
Here's 1. Or 2.
But the first one I think actually was the bigger one.
It's 25, so virtually nothing there. So you're not preferring much for nearsighted correction. Let me check astigmatism. I'm going to have you slide that on for me, please. Okay, this time what I'm going to do, Carolyn, is stand on the other side of you for a moment. Well, actually, I can probably do it from here. I'm going to twist the dial, and I want you to tell me when it's the clearest. Here we go. Did it get better or worse as I went that way?
I don't know. I can still see the 4 real plain either
way?
distance.
Okay. How about the bottom line then? Can you look at that for me?
All right. Okay, now I think I see a 5 on the
Good.
bottom right.
I'm going to keep going. Tell me if it gets worse again or it gets better.
I lost it again. So
All right.
I have to search to
I
find
understand.
those letters, and then if I lose them, it's actually blur than it was. Now I found the 5 again, so
Okay.
now it's more blur.
As I go this way, does it get
Yeah,
better
that's
again?
better right there.
Okay, tell me if this is better or worse now. What do you think, better or worse there? I can go back if you'd like.
Yeah, I think if you go back, it would be there. Was more right there.
Right there is pretty
Mhm.
good. Okay. So that's a -1 cylinder, and she's preferring it at axis 110. Pretty sure on that axis. Very good. Now I have a question for you. Is it better with this pair of glasses on or with them off? I'm going to take them off and show you. So here's on. Take your time and get a good feeling for how you're seeing there.
Okay, I found it again.
And there's without.
I still see it, but I think it was clearer with those.
Okay.
But not, not
Not
a great.
huge. Sure, I understand. It's really just fine tuning and seeing if we can get it as sharp as possible. I have one more choice. And now I've got -1 and -2 cylinder, and I'm going to compare at the same axis, about 110. Here's number 1.
I found the 5.
Okay,
It's
here's
kind of blurry.
number 2.
No,
No,
that's not good.
Not good. Too much. Too much. So 1 is preferable over nothing. 2 is too much. So we're somewhere between probably 50 and 1 cylinder in the right eye at 110. Let's try this pair of magnifying reading glasses, and this is also for crocheting or for seeing the sewing machine. So I'm interested in that. These are not very strong as well. And this is
Whoops.
the chart. It's okay. It's okay.
Where did it?
There's a focus knob right beside the lens. Right there, yep. And you turn that to focus.
Where? Sideways or?
It's ridged and it's right there. It turns toward me.
Okay, okay, I got her going now. I'm trying to hold it closer than I need to.
Yeah, this is not a very close working distance with these, thankfully.
See, Jack can make a good cake.
Okay, let's turn it over. You can keep focusing if you need to as well as you go down.
The hen was sitting on the shed.
Mm-hmm. These are the max details.
I think I got it as far as it'll go that way. Maybe I need to hold it away some more.
And what do you think there? Is it, I realize it's not very strong, but I'm wondering if it would be enough for you to see the needle on the sewing machine.
I can't. I think it's Patty, I'm not sure.
Mm-hmm. Let me take this for a moment and give you the needle back. Do you have that handy? I don't necessarily expect you to be able to thread it. I would just like to see if you can visualize it. Also, Carolyn, I don't know if you were aware that they make needle threaders that thread needles for you.
Mm-hmm.
And I'll give you a home products catalog today that you can take home and look at, but you might find there's some very useful sewing items in there that would make things much easier for you.
No, I actually have a needle threader at home.
Oh, okay.
I can't pick up the hole.
Okay.
No.
Let me hold it for a moment and let you focus it a little more and see if you can do that with focus. Keeping in mind, I'm not expecting these to allow you to do this, but if you can, I know that they'll be a really good option. If you can't, they may still work for sewing with the sewing machine.
No, I thought I could pick it up when I was done adjusting that, but I got the hole.
Okay.
Now I just got to get the depth,
Yeah,
right?
the depth is the hard part.
It's not coming in clear enough for me
Okay.
to do that.
Okay. Well, what I'd like to do, I can take that back, thank you. What I'd like to do, Carolyn, is still send you home with these to try, because you might find for the sewing machine that they work all right. They're going to allow you to have a great working distance. You're not going to have to be too close, which is really nice about them.
Mm-hmm.
And so it's worth a try. It may be enough. Would you like to try them at home?
What about the other little square
Oh,
one?
both of them,
that
definitely.
was that's the one I actually had the needle in the
I know,
thread.
that was
so.
exciting. Yeah, I would like to send both of them, and
All
that
right.
way you can compare.
Okay.
And there's no limit on how many you can take home, so you're welcome to take them both and try. And my feeling is that obviously that the other one is giving you a little more magnification, which is nice. The working distance is also closer, though, so this will allow you to be back further. So it'll just be your opinion as to which will work.
Okay.
This is a clip-on magnifier that attaches to this particular lamp. That it's not real strong. It's 3x, but it allows you to bend it and point it over what you're doing. So I was thinking, if you're at the sewing machine, the light source would illuminate. You could put this magnifier in front of the needle, and it might allow you to do it. So let's try. And I need the needle and thread back. Once again, this isn't intended for threading needles. It's intended for just using the machine in general.
Mm-hmm.
Okay, I'll hand her the needle first. There's the thread. Oh, you were right there. It was just, once again, the depth issue.
Mm-hmm. If I bump it a few times and then
Yeah,
get an
that
idea
helps.
where it is. I know I'm not there, but I do see the needle and the thread both.
Okay, good. So this is another option. And it's nice because the light source is built in, so you would have that as well. The reason that I brought this lamp over is not necessarily for the lighting, although the lighting is nice. Do you have good lighting over your sewing machine now?
No.
Lighting, as you probably know, increases contrast, which is really important
Right.
to doing those detailed tasks.
No, actually, the only light I have is what's on the sewing machine.
Oh, really?
Basically, so
That may
where
help.
where it is. Whoops, sorry.
Let me get that out of your way. That may help you quite a bit, actually. Just having a good light source
Right.
you'll be surprised how much that will do for you.
Right.
This is the type of light that's perfect for those with poor contrast ability, and it's designed for patients that are visually impaired. So it has the right spectrum of light. It's not as much a yellow incandescent bulb. It's more of a kind of blue, light bluish white tint, which is really wonderful.
I think though with sewing, this would be in my way to
Would it?
move the
Yeah,
pair of
and
jeans
it
and
may.
stuff. So.
It may. You know, you could like bend it up and curve it, and it
Right.
might, but it's an option. And I'd like you to try the others first, because this is something that I can't send home anyway to demonstrate. But if the others aren't working, we could.
She needs a sharper needle.
Carolyn, what I've set up here to demonstrate is called the MagnaCam Triad. And this is a device that projects anything below it onto a TV monitor or computer. In this case, we've hooked it up to our older version television here, but you could hook it up to any size TV. I realize this isn't the reason you came, but I wanted to show this to you because it's out there as an option. And there are many versions of these handheld devices that are less expensive than a closed-circuit television would be, but are portable. So if you were, for instance, visiting family, you could take it and hook it into their television to read things quickly and easily. And I know that your reading glasses are working well for you, as you mentioned, but I just wanted to demonstrate this. And this might have some uses for sewing. as well. So the way that it works is that there's a camera below the device, and as you slide it over the text, obviously it appears there on the screen, and we can change the contrast brightness level by twisting this dial on the top if we want to. This is the dark black on white mode, enhanced black on white. And then it also has a color version, a color mode. So anyway, I'm going to let you just try it for a moment and see what it's like. Let's see if you can read with that on the screen.
Actually, it's bigger than it needs
Exactly.
to be. So they're smoking one word at a time.
Yeah.
That of smoke.
Right.
Now where do I go?
Going back to the next line is the trickiest part. You would get the
Yeah.
hang of it with practice. And then as you tilt it, it makes the words crooked, so you have to be
Right.
kind of straight with that.
For example, 2 sorts of smoking that. What?
That of smoke, hyphen.
Of smoking. That of smoke. Oh, this is where I'm having trouble.
Yeah, it takes practice.
Smoke stacks and that of cigarettes.
Very good. So at least you see how it works. Now the size of the magnification can be altered with certain versions of these devices, and the size of the TV affects the size of the magnification
Okay.
also. So if you had a smaller TV, it wouldn't be as big.
Right.
But you get a feel for that. Now where this may work for you is that there are certain versions of these devices that can sit up on stands, and then you can adjust the magnification up to compensate, and then you could work
move
under
the
it.
paper,
Right, you could work under it.
which was like the one I had before. I could move this underneath the
Exactly.
screen.
Right, and the advantage of that is you could sew under it or crochet.
Right.
And if you had enough space under
Right.
there. So that's something to think about for the future. Once again, I know that you don't need it right now. The other option are devices like this, and I'm not going to turn this on, I just want to show it to you. This is a camera on wheels that has a twistable head on it. Go ahead and feel that and turn the head. You see how that rotates?
Yes.
It can point at anything near or far and magnify it, and it connects into a television or computer once again.
Okay.
So the difference between this device and the last device is that this is far and near, or intermediate, any distance, whereas the Triad device that you just tried is just near. What I was thinking with something like this is that you could point it at your sewing machine and look at a television screen next to the sewing machine, instead of looking actually at the machine, which would be a way around it. And you can get it very, very large, way larger than you'd even need with something like this. And there's a new one of these, a version of this called the Acrobat that just came out. It's a really, really neat device. And even though our devices are more costly, they do have a lot of uses. You can use them for many things.
Right.
So you may not be ready to do something like that, but I just once again wanted you to
Again,
know.
it would be okay to see down here, but where you're trying to move your material around, I would be looking over here and wouldn't know where my material was here.
Well, you'd still see what you'd see on under the sewing machine as you normally would.
Right.
It would take some practice to get your brain to figure out
To
that
feel where-
what I'm feeling here is actually over here on the screen.
Right.
But you would, I think, would be successful at that with some practice. So it is doable, maybe awkward at first, but patients do great with that once they practice enough. So if you're ever interested in trying anything like that, again, let me know. And I even have someone who can come into your home and set it up by your sewing machine if you wanted to try it out there too. Any questions on this so far?
No.
So you have some astigmatism, Carolyn, and it's not a huge amount. It's a small amount. It does clear it up a bit. Realistically, it probably won't make a big difference for you, and that's why you've chosen to not wear your glasses, because it obviously, in your opinion, it doesn't do much for you there. The pair of glasses we had prescribed years ago, probably the pair that you have sitting at home that you don't wear, are also correcting your astigmatism a little bit. Although you're preferring a little more correction now than you did years ago, but still very minimal. So
I
at this
think
point,
I probably got those from Dr. Coates in Cadillac.
Oh, okay.
That was my last pair of glasses.
Very well could be, and the records that we have
Was
are
it Cook?
Cook.
Dr.
Yeah,
Cook.
Dr. Cook. I know
Not
him.
Coates
Yeah.
is another doctor.
Okay. Well, very good. At least we've determined that it's not a large prescription and it doesn't do a whole lot. Also, Carolyn, I don't know if you were aware that they make needle threaders that thread needles for you.
Mm-hmm.
And I'll give you a home products catalog today that you can take home and look at, but you might find there's some very useful sewing items in there that would make things much easier for you. Very good. Well, Carolyn, I think I'm finished with showing you things for now. We've got a couple of things for you to try at home as far as the sewing is concerned. Anything else that you are interested in or have needs for right now?
No.
Then let's give you some information to take home about what we talked about today, and then have you back in a few weeks and see how you're doing with the devices, and then we can go from there. If they're not working for you, we can try some other options. If they are working for you, you're welcome to order if anything, or we can also see what the commission will do to help.
Okay.
The two devices that we're sending you home with are on the lesser expensive end of things, and the commission very well may help with that if
Okay.
they have the funding to do so. So we'll try. So I'll get you a referral as well to the commission, and I should be hearing back from them probably in a month, month and a half. It's usually their time frame, or they may call you. So if they do call you, please let us know. Keep in
All right.
touch about it. And can we look at your eyes very quickly with the
Sure.
microscope? Then we'll be finished. Thank you. We'll be back to the chair. So, Carolyn, I've pulled some information to give you to take home, and it's basically a summary about visual impairment. It talks a little bit about just living life with visual impairment, and it might provide some information that you don't already have. I know you're experienced, and it's been a number of years, but just in case. There's also a pamphlet on a service that's a free talking magazine. Once again, I know you enjoy reading and that you are skilled at reading with your reading glasses, so you don't necessarily need this. But I thought,
do have that.
Oh, do you? Okay.
The same one that you have over there, I have.
Which one is that?
That recorder.
Oh, the talking tape player?
Yeah.
Okay. And that's actually a different one than this one.
Oh.
That is provided through the Library of Michigan.
Right.
Which is a great service as well. And that's primarily books, isn't it? Or does it do magazines also?
Just books. Well, I think I could order magazines,
Oh,
yes,
could you?
but I never have.
Oh, okay.
Right.
Well, if you're interested, this is a magazine service, and they have pretty much any title you can imagine. And sometimes, even though you can read it, it's nice to not have to read it.
Right.
To just listen, and it's enjoyable. There's also a pamphlet on macular degeneration. I'm sure you've had those before, but it might provide some additional information. There's a pamphlet on our clinic with some phone numbers that might be useful. And my card and Rhonda's card. Rhonda is the person that does the scheduling. She's also the technician that handles the devices. So if you wanted to return something or had questions about using your devices, she can handle those questions.
Okay.
So feel free to call her. She's also the person who will set up your follow-up appointment if we don't get it set up today or need to change it or anything.
Okay.
So are there any... Oh, thank you. And probably the most useful piece of information, this is a home product catalog that has all sorts of things that might be useful to your everyday life. We don't sell the products at all. We have nothing to do with this company. It's just that this is one of the companies that's provided us free catalogs to hand out. So feel free to order if you
Alright.
find anything that might be useful. Do you have any questions about all of that?
No.
Okay, very good. Let's go ahead and take a look at the health of your eyes then, and we'll see you back in a couple of weeks.
Okay.
All right.